As Justin mentioned, I think I've met many of you through the last tutorial last week, but today we're going to be talking about how to read a research paper, which is a really, really critical skill, not even if you're like entering research, but just to know what other people are doing, so that you're not repeating the same thing, but you can learn from other people's mistakes. There's a common phrase in like research also of like standing on the shoulders of giants. Everything that we're doing is kind of a contribution that builds on each other. And so knowing sort of where the field stands and what remains to be done is super valuable, because it's just through incremental change that we can all work together and make a difference. So today we're going to outline how exactly you can read a research paper. Well, you can do it in any way, but we're going to outline some best practices as to how to sort of approach it, because a lot of times research papers can be a little bit intimidating at first look. So again, why this skill this week? The week one deliverable is a project proposal document for the ED board, and you have to build it based on 5 papers. So you got to find 5 good papers and then make sure you understand them. So to begin, what's being asked for is a 2-page background memo on AI-assisted ED triage developed by reviewing at least those 5 papers, and that's going to be due Tuesday. And we'll talk about what exactly those specifications are for those 5 papers. But just to keep in mind, you will be going through 5 papers at least briefly. And in terms of the realistic time budget, reading those 5 papers could take you about 15 hours, which is a significant amount of time. But there's this 3-pass method, which is what we'll be going through today, that could save you a lot of time because it can help you sort of identify what's critical in those papers and just like the impact that they might have in the questions you're trying to answer. And so the difference here is the method that you're actually using and how you can best use that time to get what you need out of those papers. And in terms of what sort of good in your deliverable looks like, we want 3 to 5 sentences per paper where you're extracting 4 things. And we'll go through these 4 things in a little bit more detail as we continue through the presentation today. But just to kind of prime you for them, they're the problem, the method, the outcome, and the limitations that the authors themselves named. And so 3 to 5 sentences, if you're looking at a 8 to 10 page paper, sometimes a little longer, sometimes a little shorter, part of the challenge in that is actually being that concise and being able to sum up what they did in something that brief. But that's a very, very valuable skill to have. So we'll talk through how we can do that. Okay, so as I mentioned, we're going to focus on these 4 topics that you want to be able to ask and get out of every paper that you read. If you can't answer all 4 of them, you want to take a step back and reread until you can effectively. So the first one is the problem. Does anyone want to share what, I know it's written here, but why does it matter to identify the problem that a paper is addressing? If anyone wants to unmute and share. Yeah, go ahead, Aiden.
Yeah, so identifying a problem allows you to understand generally what the paper is trying to address and just give you a general idea of what it is to expect from the paper, their approach as a result of said problem, and yeah, just a general idea of what everything's about.
Yeah, so it's kind of the question of like, what are we even looking at, as you just said, right? So it grounds us of, is this even relevant to what we're thinking about? Exactly. The next might be the method. Does anyone want to elaborate a little bit more on what the method is important for? Or even just define what method means. Any takers?
Maybe it's like adding credibility to the information, so how it was collected and showing that it's actual, accurate, and verifiable information.
Yeah, so the method outlines exactly what the person did, right? And so you mentioned sort of like accuracy or like where the source of the data is, right? So if we want to know what, like, if we want to better understand what the person did, or the people and the authors did, we want to understand where they got their data. And sometimes that will be from simulation, sometimes it will be real patient data, but understanding sort of where that data comes from and what they're doing with that data is super informative in terms of understanding what they're doing and why it's valuable. Once we have the problem, the method, so we have the what they did and the how they did it, we want to also identify the outcome. Does anyone want to elaborate on what outcome means?
It would be about the results that they got and specifically relating to the problem. So did they solve it or did they not? What conclusion did they come to from it as well?
Yeah, exactly. I want to highlight what you just said there too. You mentioned both the results, which is like the true kind of raw numbers, but also what conclusion, how do you interpret those results? What impact do those results have? So you want to understand sort of the so what almost of the question. So we have the what, which is the problem, the how, which is the method, and the so what, why does it matter, and like what can continue to what can be drawn from this, and why does it matter? And then the last four of the four questions is this limitation. What does anyone want to expand on what limitations mean? Yeah, go ahead, Aiden.
Right. So limitations would be the boundaries and what the paper wasn't able to accomplish or wasn't able to follow through with. So yeah, boundaries to indicate the limits behind, well, using the word itself, limits behind what it is you're trying to accomplish.
Yeah, so limitations are sort of confining the scope of where this is applicable, depending on sort of the context, sort of like how generalizable might these results be, or what still might need to be done. And so when we're doing this read through every paper and we're answering these four questions, we want to start by first looking at it from the perspective of what do the authors actually write. We'll talk through at the end a little bit more about limitations and sort of a critical view of reading papers. But for now, we just want to think about what do the authors actually say they did? How did they do it? Why did they do it? So what? And then what is the extent in which we can continue to apply it? Right? So there's these four guiding principles that we want to keep in mind. So again, taking a step back now, because we know that we care about the what, the how, the so what, and sort of the boundaries or the limitations. What does an academic paper actually look like? How do people communicate their findings in academia? That's what I was blanking on for a second. Okay, so if you kind of look at this timeline at the top of this page here, not really a timeline, but structure, we start with an abstract. So an abstract is typically, I'd say, about 150 to 200 words. It's kind of a general overview of what did this paper do, how did they do it, and what did they find? So aligning with our four questions that we're looking at, typically you'll find the answers of question 1, 2, and 3 within that abstract. It's just sort of that main summary of what happened. Then the authors will go into this introduction. This is typically, I'd say, a little bit less than a page, depending on the context. But it kind of just introduces you to the question, what it is that they're trying to answer. Exactly. I keep saying these buzzwords of what and the question and the problem, but ultimately those are the guiding words and the things that we have. Then you'll have a literature review. So as I mentioned, a lot of academic work is done in a sort of building upon each other, standing on the shoulders of giants type of method. And so you want to acknowledge what has been done by other people when you're writing a paper. And so that will typically come in a section called the literature review. Sometimes that will be lumped into the introduction. It kind of depends stylistically on what the authors choose to do. But the literature review is typically more of like context of what's been done previously. So once we know what the problem is in a very detailed way in the introduction and literature review, the methods begin to more concretely outline the how it was done. So how are we approaching this problem? What are we going to be doing with our data? How are we trying to answer what's being done? And then once we understand what we're doing, how we're doing it, we can say, okay, so what came out of that? What are we seeing in the data? And that's where the results come in. So that's where you'll maybe quantify like how effective a model was, or talk about sort of just the bare bones of like, what did you find with this model? Then once you have those results, though, it's critical to interpret those results. Part of what academia is trying to understand sort of the world around us. And so, cool, an 80% number is interesting, but what is that implication of that? And so the discussion and the conclusion there are where you're kind of going to get those so what answers. So rather than just like, oh, this was 90% effective, it was 90% effective, which is higher than previous baselines. And that's important because it gives us X, Y, Z. That's where you can kind of, where the authors will elaborate more so on, again, what the impact of what they did was. And so a lot of times students will try to read sort of like you've been taught to read a book. You start from the beginning, you go to the end, you read everything in between. But in order to digest 10 or so pages of an academic paper, kind of sitting down and doing that isn't actually super effective at your get-go. And if you're going to sit down and sort of try to digest it all at once, it's going to be potentially overwhelming because there's going to be a lot of like technical words that you might not be familiar with, which is okay. That happens to all of us, but it's just not the best way to do it. And so, as I mentioned, we have these 4 questions, and there's actually a better way to start to think about those 4 questions before we deep dive into all of the meat of the paper itself. And so, as outlined here in this timeline, each of the sections within the paper can give you some context about about what is. Sorry, let me take a step back. Each of the sections of the paper, the abstract, the intro, etc., provide some of the answers to the question. And so if we want to be efficient and even decide, is this paper worth reading? Does anyone want to chime in of what maybe subset of these sections we would want to start with so that we have at least an answer to each of the questions? Does anyone have an idea?
I assume you'd want to read the abstract first.
Yeah, you want to read the abstract, right? Because they'll give you an answer to question 1, 2, and 3, hopefully. That's what a good abstract should do. What are we then missing an answer to? And as a reminder, our 1 is our problem, our 2 is our methods, and our 3 is our outcomes.
We're missing all limitations, which we'll find towards the end of the paper in the discussion and conclusion.
Yeah, exactly. Well, you're missing the limitations. And so it's important to understand sort of, what are those limitations? What is the scope in which the findings of this paper can be applied? So typically you'll want to start with the conclusion. It's typically a little bit shorter, and hopefully we'll just like give you at least a 1-sentence summary of what the limitations are. If you can't find them in the conclusion, you might jump back to the discussion because hopefully it'll be in there. That's where your question 4 answer should be. Again, also stylistically, some researchers will also lump the discussion and conclusion into one. So that just kind of is a little bit more of a nuanced thing. But yeah, when we're starting to read an academic paper, we want to be able to answer all 4 of these questions quickly before we get too invested in this paper. And so we'll actually start, rather than reading from front to back, we'll start with the abstract, and then we'll spoil sort of what is in the meat of the paper by reading the conclusions. What can we take away from what was done? And then that will give us an insight of if it's even worth diving into everything that's in between. Yes, and then so this bottom bracket just jumped out here. But so a literature review is an important part of, well, actually, it's written here, but does anyone want to elaborate? What do we mean by state of the art and why a literature review is important? Any takers?
Oftentimes when you're doing new research, you want to ensure you know what other people have done or what problem statements other people have made. So literature review would tell you, would show what other people have done so that you know where you're going to go after this.
Yeah, exactly. So it gives you the state of the art, which is basically what the best thing that's working right now is doing. And then, yeah, I can expose some of those limitations that you just mentioned of what remains to be done. Because yes, sometimes it's valuable to redo something someone else has done to learn from it and kind of continue going forward. But if you want to sort of expand what is currently being done, then you need to understand what has been done so that you're not just redoing what others have done. And so, yeah, it's very critical to understand sort of where the field that you're interested in is currently at and where your contributions can come into play. Okay, so there's this 3-pass method paper, which is adapted from this other article, where if you're interested in learning sort of more concretely about it, I believe this is in some of the resources that were shared with you. But we're going to outline a way that you basically do 3 passes, as implied by the title, each with different goals. And you're not actually reading the entire paper 3 times through, but you're applying this sort of structural method of taking what you actually want out of the paper, where each pass is going to dedicate a little bit more time to each of them. So in pass 1, what we're going to call it is a goal of triaging the paper. Here, we're going to start with reading what we were just discussing. So it's important to read the title, of course. The title should be informative and tell you what the paper is about. You should be able to sort of decide whether or not it's worth reading a paper by the title itself. But sometimes you'll still find that you have a stack of 40 potential papers that you could read, where that would take you a lot of time. So then you want to see, okay, who are the authors? The authors are valuable, as well as where the paper was potentially submitted or published, because it can give you a little bit of context to the credibility of the work itself. So if there are big names in the field that have been contributing to it as well, likely that paper is one that's worth reading. That being said, there are also not as big of names that are doing very important work, and so the name of the journal can provide some of that credibility as well. And so you want to just kind of double check, like, is this a credible source? Was this peer reviewed? Sort of, should I be trusting this? Then, as we mentioned, you want to get to the abstract. That abstract will answer our first 3 questions of the what, the problem, the how, the methods, and the outcomes, hopefully. Again, that's a standard that authors should be doing, but at times you'll find that people don't necessarily fall into that. And so the abstract's critical. The section headers can be valuable as well. Sometimes they will be not super informative, such as just introduction, literature review, methods, etc. But sometimes they'll tell you, like, within their methods, they might have a subsection that's like data acquisition, which will tell you where their data came from, simulation results, and then maybe something like true patient results or something like that. That gives you a little bit more context, but without actually diving into each of those paragraphs. Figures are a very, very informative way to sort of understand what are these authors doing, what are they finding, and hopefully those figures are also associated with like informative caption. So captions are typically, like, I'd say anywhere between 1 to 4 sentences, depending on how intricate the figure is. But how I've been taught to even write papers is you usually start from the figures themselves. The figures should be able to tell your story for you. And so you should be able to see visually what's going on. And then we haven't yet answered our 4th question, which is those limitations, which hopefully we'll find in the conclusion. And so that conclusion should give us information there. So with the abstract and the conclusion, we should have all of those 4 answers. And then also there's a note here to look at the references list. The reason the references list is important is because, as we were just mentioning, understanding where the field currently lies and the state of the art is critical. And so if these authors aren't citing some of that relevant work that you're already familiar with, that could be sort of a red flag to pay attention to, of like, why aren't these people including work like that? And so this pass should take maybe 5 to 10 minutes. We'll do an example of what this first pass might look like in a second. I think it's on the next slide. But this pass should give you, again, those answers to those 4 questions, which can then give you enough information to decide whether it's worth continuing into Pass 2. Pass 2 should take you about an hour. So again, now you're sitting and dedicating a little bit more time to this. And what your goal here is comprehension. So previously we checked, is this paper worth reading? And now we're basically saying, yes, this paper is worth reading. It's relevant and applicable. Let's understand actually what the person did. And so here what you'll do is you'll actually read through the paper, because you're not trying to necessarily like recreate any of the results. You don't actually need to sit down and digest every equation or every proof, but you want to understand a little bit more concretely sort of those 4 questions that you're asking at in a way that you can sit down and tell your friend about it in a couple minutes. Alternatively, you could write 3 to 5 sentences as a deliverable that summarizes, again, the what, the problem, the how, the methods, the so what, the outcomes, and then the limitations, which tell us sort of the scope of what can be done. And so far we've spent maybe an hour and a half on the paper, and we have a general understanding, but sometimes you want to go even deeper than that, right? So then Pass 3 might take you several hours. And the goal here is reproduction, where you want to actually truly understand the nitty-gritty of what's happening. And you want to potentially build off of it. So as I mentioned, standing on the shoulders of giants, if there's actually equations and models being used in some of these papers, sometimes you'll want to implement those equations and models, because as you're actually doing that reproduction, you can see sort of, oh, this was an assumption that was made. Was that a valid assumption? Should I loosen that assumption? And things like that, which can give you a little bit more insight of sort of what remains to be done. And so again, here you also want to check the references, understand who they're referring to as they're working as well. Does this 3-pass method make sense to everyone? Can people react in the chat or give me like thumbs up on the screen? Or does anyone have any questions here? Yeah, I see a question. Or was that a reaction rather than a question? Okay, I'm going to assume it was a reaction rather than a question, but if anyone has questions, also feel free to jump in. Oh, sorry, my little preview of all of you in my corner is blocking my slides now. Okay, continuing. Okay, so now we're going to work through an example together. I believe you should all have access to this paper, but in case you do not, I will also pull it up on my screen. And we're going to try to do that first pass 1, which again should take us 1 to 10 minutes, or 5 to 10 minutes. 1 is a little bit too short, but we'll start by reading the abstract. And hopefully you all have access to a piece of paper or like the notes app in your phone or something. But we want to see if we can write out the 4 questions that we are asking about the problem, the method, the outcome, and the limitation. This is not being graded or anything. We are wanting to just do a live example of how we might do this together. And so I'm going to, I think you should still see my screen. In case anyone doesn't have easy access to the abstract, it's here on your screen. I'm also going to start a 2-minute timer. And so we're going to all read through it and try to answer our 4 questions. Oops, I restarted the timer. Okay. Oh, yes, someone also posted in the chat. Thank you. we have about 30 more seconds. This is actually a pretty short abstract, but I'll let you guys keep working on answering those 4 questions. We're going to be doing a sharing out session, so are you ready? That's loud. Stop. Okay. Okay. Does anyone want to get us started on the first question? What is the problem that they are trying to address? Or does anyone need more time?
I
Right.
have ERs are overrun by patients, which makes it hard to determine which patients to see first.
Okay, does anyone else want to add to that or rephrase it in a different way? Slash, is overcrowding the only thing that they care about? Yeah, go ahead, Imani.
Yeah, I had as well that the cases are becoming more complex, so it makes it a bit difficult to actually prioritize the patient.
Yeah, so there's sort of more complex cases, as you mentioned. I see in the chat also we have overcrowding of the ED and limited resources makes it difficult to address patients in a timely manner. Yeah, something else that I also noticed as I was reading with it was they mentioned as well the aging population, right? Whoa, sorry, that was not correct highlighting. So yeah, there's basically this issue of an overcrowded emergency department that they're hypothesizing is due to a variety of things, including aging or not due to, but it's also further worsened by an aging population and complexity. And so that's the problem, right? How are they trying to address it? Does anyone want to get into our question 2? The methods.
They employed several AI models and used to evaluate the SVM, the random forest, the ANN, and the GBM. And they use like the stacking model as well.
Yeah, so they implemented a bunch of models. And what are those models doing?
They're predicting.
They're predicting different AI. They're predicting patient triage levels in the different emergency departments.
Yeah, exactly. So again, as a reminder, our problem is overcrowding. Our method or our solution then is trying to make triage effectively more efficiently. And how we're doing that, or how this paper is doing it, is through the implementation of a variety of AI models, right? And then, so what? What did they find based on those models? Going into our question 3, what are the outcomes that we can get from this paper?
The SVM and the GBM perform best individually, but like the stacking model achieved the highest overall accuracy for like precision, recall, and the F1 score.
Yeah, so conclusion-wise, we see that they report a variety of prediction accuracies across some of their models, and then they also implemented some sort of a stacking model, which is the most accurate with these respective values of accuracy, precision, etc. Okay, so we have answers to our first three questions. What about limitations? What limitations do the authors mention?
Maybe one limitation is that it's based on a Korean system, so it's not a universal triaging scale that they're using.
Yeah, so that's a fair thing to think about. When we're actually looking to answer these 4 questions, it's important to sort of recognize, like, yeah, they talked about using the Korean triage and acuity score. Something that I want you to notice, though, in the abstract is they didn't actually mention any limitations specifically, right? So it's important to pay attention to what I'd call some of these like yellow or red flags of, okay, this is something to keep in mind with this paper. But it's also important to see, are the authors actually like claiming what they do well? And so there's not any explicit sort of mention of limitations in this abstract, which isn't crazy, right? Because if we go back to our diagram, where was it? To this one, right? The abstract is typically going to give us actually the answers to our first 3 notions. And sometimes we're going to have to look into the conclusion or the discussion to get the answer to question 4. So I kind of set you up with a little bit of a trick question, but it's still important, as you mentioned, Tessa, to pay attention to sort of what is the scope in which we're working with here. So now returning back to here, excuse me, we are able to answer question 1, 2, 3, but then we want to still look at question 4, which is the limitations. So let's go together. Sorry, I'm skipping back and forth. Okay, actually, yeah, let's go through this slide, and then we'll take a step back and go to reading further into discussion. So as we mentioned, the problem was the overcrowding of the ED combined with the aging population and the case variability. And so the authors want to leverage AI to enhance the triaging process, which is what you all mentioned. They outlined 7 different models that they used, and what the models were doing was predicting patient triage scores according to this specific scale. And then the outcomes, as was mentioned, I can't remember who said it, but thank you for participating, that there's various numeric sort of representations of how well these models are predicting. And then lastly, the limitation wasn't mentioned in the abstract. We paid attention to some yellow flags that we were waving as sort of what we think might be limitations, but we want to see what the authors themselves say. So now let's continue into the discussion section of the paper. Oops, no, spoiler alert. And let's see if we can find where that limitation itself is. So let's go down. Sorry, this might make everyone dizzy looking at my screen. So we have the conclusion, right? Can anyone find a sentence here? I'll give you a minute or so to read through this. That outlines what the authors count as the limitation.
There's one sentence that says a key limitation is a reliance on a single data set, which hinders generalization. So it's very narrow towards the data set from one hospital, I'm guessing.
Yeah, exactly. Yes, so sort of as you had mentioned before of that yellow flag, we were talking about it being the Korean triage score or scale, which might limit it to a specific area of the world. But here we also see further that it's actually just one data set. How large that data set is, we'll figure out when we dive deeper into it. But this is something that they mention. And so that's something that's super important to consider, because especially if we want to start applying these tools, maybe in the Caribbean context, some of these things that other people have found elsewhere in the world might not actually translate very well to our specific environment and what we want to be doing. And so it's important to be paying attention to sort of what do the authors say as limitations. And so now thinking back to our past number 1, we were able to answer question 1, what's the problem? Question 2, how are we addressing it? Question 3, what's the outcome? And question 4, what are the limitations with this paper? Right, so as you just mentioned, we found the limitation. Excuse me. Which is effectively the potential challenge of making the method generalizable. And so now we would be able to start writing our 3 to 5 sort of sentence summary. Sometimes if you want to spend a little bit more time understanding the methods, you can do that comprehensive pass-to read. Depends on sort of how well the authors ultimately wrote the abstract and discussion and how thorough you want your summary to be. And then just a note here of why it matters is what I was mentioning before. But the single data set sort of question of generalizability is very common in AI and ML solutions. Everyone sort of talks about how sometimes AI and ML solutions can be very data hungry, but also just they ultimately do need to be trained on something, which is a finite set of data. And so choosing sort of where that data comes from or just deciding what we have access to can impact the generalizability and just needs to be thought about critically of does it make sense to use this in my new context, or would we need to like retrain the model or something like that. Great. Next slide. Okay. So as I mentioned, we want you to start paying attention sort of to those yellow and red flags that you might be seeing as you read literature. So as Tessa had seen in the introduction, they didn't explicitly mention the limitation, but we had our own little, this is interesting. It's only potentially one data set go off. And obviously, once we read the conclusion, the authors explicitly mentioned that. But we want to sort of listen to and train that inner sort of skeptic within us to understand, is this work worth my time to read and learn from? And so as is outlined here, peer review is a floor, not a ceiling. And so you want to recognize that academia is a field that is built upon sort of looking at each other's work, but there is sort of a minimum bar that just has to be met. And some papers will do way better than that minimum bar. Some will just kind of hover right around it. So being critical and being able to sort of estimate where that paper lies is critical. And so here are some outlined red flags, which I encourage you to, if you go through and read this paper through that second pass method of sort of comprehending it, pay attention a little bit more to some of these red flags. But for now, we'll just kind of read through them. So some of them are like inflated comparisons. Does anyone want to explain to me what an inflated comparison might be, or why that might be something to pay attention to as a red flag?
Many companies want their metrics to be very, very high, so they'll often make a comparison that technically could be true, but is not honest. So for example, some AI companies will say, we've improved our AI accuracy by 45% or something like that, when actually they're comparing it to the model they released 2 years ago instead of the most recent model. They don't clearly state that, but because they did not say it was the most recent model, it is technically true, but it is dishonest.
Yeah, exactly. So we want to consider sort of the context of what are we comparing against? In what way are we measuring that improvement? Exactly. The second red flag on here is the single site, single data set. So as was mentioned, I won't make anyone share out on this, but we had talked about how we could hone into this a little bit in the abstract, but then in the discussion, the papers actually sort of outline that better. Sometimes, as is outlined here, authors won't actually even include that sentence that we had found in the conclusion, but you should still be able to see sort of what their training data set was in their method section, assuming it's a well-written paper. it should be written in a way that you could literally sit down and reproduce all of their results. Sometimes you would have to collect the data yourself. Sometimes they might make data sets actually available, but just paying attention to sort of what is the scope that they're working in. This next one is about synthetic data inflating metrics. Does anyone want to talk about what we mean by synthetic data and what sort of the implications of this might be?
What I understand of synthetic data is that you're feeding it data that's not fully reflective of real life. So the data will be quite, I want to say similar. I don't know, because in real life you have really complex cases that nobody would think about in a synthetic situation, and real life is unpredictable. So the accuracy of synthetic data may not reflect what real life data will actually look like.
Yeah, exactly. So kind of building on what you just said, in order to generate synthetic data, we typically have to use some sort of model to make it. And so by using that model, we're inherently restricting ourselves to be a little bit less noisy than true human data is, which is, I think, what Tessa was trying to say as well, or was not trying to say, what you said, but just to put a more name to it. It's usually generated by some sort of model. And so we're inherently kind of confining what that variability in the data set is, which is not necessarily representative of the true data we'll see in the world. And so as outlined here, it's important to recognize sort of what of the data we're looking at and what comparisons are being drawn from that synthetic data where we've reduced some of that variability potentially versus what's actually being tested on the true. So that's super critical. There's been a lot of work in sort of model development of patients and things like that, but ultimately many models make, not many, all models make some inherent set of assumptions, and those assumptions are what slowly take us further and further away from reality. And that's okay. Models are useful as long as you're actually using a model that's valid in the context you're working on. And so kind of talking about what is being done on true patient data versus what's being done on synthetic data is important to pay attention to as well. The next red flag that's mentioned is this tiny gains, big claims. Does anyone want to talk a little bit about this one?
Okay, so necessarily this means that the researchers are reporting like very small improvements and they're making it sound like some big major breakthrough. Okay.
Yeah, so that's one way that it can happen. It can be like our work relative to some prior work had an improvement, or like something that's 80% versus 79%, and that's better because it's that 1%. That's one way that they can do it. I think what we see more so in this paper though is they had presented, like, I think it was 6 different models and then a stacked model, right? And so that stacked model basically takes like an aggregate of those 6 individual models, and they found that that stacked model is what's giving us that 80% improvement over just the one GBM model of 79%. And so we do see, again, that improvement here. And it's not against prior work, but it's in the context of their own work. But if we think about it, the stacked model, that means we had to build all of the 6 other models, figure out how to stack them, and make them give one output. And so there's a lot more work that had to be done. And so a question here is like, is that added complexity worth it? Or should we just have stuck with that GBM? Like, is that 1% gain, like true gain? Or is it even within just the noise ratio of if we tested this on 10 different samples, would these actually have flip-flopped a little bit? So it's both in the context of, as Azaria mentioned, comparing against sort of baselines, which is what we'll refer to as prior work that's been done, but also just within our own work, what exists there. And then lastly, one that's super important, metrics without clinical context. Does anyone want to elaborate on this one for me?
In many contexts, having accuracy, precision, recall, F1 score, those are really, really good to compare and standardize. But the issue with that is those metrics don't translate or is unclear for a reader. How does that look in another context or specifically in what you're doing? So for example, if you mentioned an AI model produces 45% less hallucinations, is this you saying that after a certain amount of tokens, then it will start hallucinating, or it's not giving enough context to tell you whether or not this accuracy or value score you're giving means anything to us?
Yeah, so I think the critical word here, as you mentioned, is context. So 80% in this context might mean something way different than in a different context. An example I also like to think of is like autonomous vehicles. They're supposed to be like on the roads, etc. But if you hear that these autonomous vehicles avoid accidents 95% of the time, you might get worried about like, oh shoot, but what about that other 5%? But if you think about human drivers, and I'm making up these numbers, but let's say human drivers avoid accidents 87% of the time, well, the 95 looks better than that 87. It's obviously not perfect, but having something to compare against. So what does 80% accuracy mean in an ED? What is the triage level like accuracy of doctors themselves? How often do they miss how critical a situation is? And then even like how many patients per shift in an ED? Is this just one person might be misclassified and they might be misclassified from like a level 2 to a level 3 or vice versa? Are they typically classified as more important or less important? Because that directionality also matters. And so kind of thinking about the translational impacts of some of this modeling and AI application into a real work setting is something to pay attention to. And so these are all just things, again, to pay attention to. Something to keep in mind, though, is that, again, you can't solve all of the world's problems in one paper. And so there's always meant to be space for limitations and things like that. But it's just a way to check, is this paper even like worth my time to read? And is it contributing in a way that makes sense? Now, as you all know, we expect that you are using AI resources. It is a tool that you should be comfortable with in today's world. And so we want to sort of remain true to what we told you of we're grading you based on understanding, not on whether or not you used AI. And so it's okay to continue to use AI as a resource, and that's something that we want you to do. That being said, we want you to be smart and critical with how you're using AI. And so some ways that you can use it effectively is sort of more as like compression of what you have read. So ask for it to extract maybe sometimes some of those answers to those 4 questions so that it can find you those answers within the paper more quickly than you might be able to itself. That might be if you're like on a time constraint or if you just want to be more efficient. You can also use it as a comparative metric, like, did I understand this well, especially as you're slowly beginning to build up your base and your these skills. Use it as like a partner to compare against. AI can be great for that. It can also be used to rewrite for non-academic audience. Sometimes we'll be using a lot of like technical jargon is a word I like to use, but words that might not make sense to a lot of other people. So it can help you sort of rephrase things. And then it can also be sort of used as a critic of your own work. Let it give you feedback as well as you're growing as well. Again, you want to be critical as you're using AI. So you want to make sure to check for any hallucinations, check that it's not making up citations, and things like that. Also, as a criticality, never paste true patient data into a chatbot. It is critical to maintain privacy of true data. Here are some example prompts that can work. On a later slide, I'll encourage you to take a screenshot of it that will kind of have these for you as well, as you kind of play around with both reading the papers that you have this week and also just seeing how AI can help you do that as well. Oops. Okay. Another thing that we want you to do this week is citations. So as we mentioned, each paper will have at the end sort of a references list, and that's critical because you can see sort of who did they learn from as they are developing this paper. But also if you're like reading the literature review section and there's sort of a branch of what the authors are talking about that seems interesting, looking at one of those sources that they actually cited can be like your best next step. Starting at what did they read, and sort of using that as what you should read next. There's various different formats in which citations can be done, and this week we're going to have you do one of these citations manually, just so that you understand what it entails. But next week we'll introduce you to one of the existing citation providers, I'd say, Zotero. I personally use a different one, but there's a bunch of them out there, but we'll just standardize your experience next week. And so depending on what audience you're looking at, the format of that citation might look a little bit different. So whether it's like the first name and then the last name, or the last name and the first letter, whether or not there's quotation marks and whatnot, it's just a formatting issue, an issue of formatting. But it's important just so that people can find what it is that you're referring to. And then, yeah, as mentioned here, AI can be useful in creating this, but it can also hallucinate. It can also be inaccurate. So you want to be able to check your work and make sure that it exists. And then there's each paper that's been peer reviewed and like published also has a DOI number. You can go on doi.org and check if that paper actually exists. And that's a great way to do it, so that you're not sort of relying on any fake citations that might not actually exist, and you don't want to do that and lose credibility. And so this isn't meant as a scare you away from AI. This is just as a reminder to use your critical thinking skills and make sure that you're using AI responsibly.